Welcome back to Rural Health Summit, a season of Rural Health Today. In this season, we're sitting down with a series of guests at the MHA Annual Summit meeting, where many healthcare executives and leaders across the state meet to review the last year of collaborative efforts and the work that we've accomplished. In each episode, I'll ask my guests to give us an update on their hospital or healthcare organization and to touch base, so to speak, on the healthcare issues they see that is most pressing in their corner of the rural health world. Welcome to our fourth episode of our Summit series. Today we're talking to friend, colleague, and leader, Helen Johnson, who is the Chief Executive Officer at Helen Newberry Joy. Wow, that's a mouthful. Helen Newberry Joy Hospital and Healthcare Center. Did I get it right?
You did. There's a lot of H's in there.
There's a lot of H's. What the H is going on with that? But we'll talk about that later. But Helen, why don't you tell us a little bit about yourself and Helen Newberry Joy? Because this is a national podcast. People are going to be like, what is that? Is that a place? Is it a town? Is it a hospital?
Yeah, absolutely. So Helen Johnson, I'm healthcare leader. I've been in healthcare for about 30 years, have worked all across the state of Michigan, and really have found myself back in the Upper Peninsula again for the third time.
Oh, is it the third?
Third time's a charm,
I did
JJ.
not know that. I didn't know it's three times.
I love it.
And previously, though, Helen, let's not, I think we need to, it's important to highlight, nurse leader.
Yes.
So you have the clinical side.
Keep that RN.
And then CEO of a hospital within a system, right? Previously, yep. And then now leading Helen Newberry Joy. So you bring to the table clinical, you bring operational, business. I think it's the best person for the job to lead a community hospital. And so I want to congratulate you, first of all, for securing that. I know those, I heard, and I'm being sincere, that there was a lot of competition because there's very few CEO jobs in this country, and the competition can be high. And so congratulations to you for securing that. Obviously, your background, your work experience, and we've talked about your work experience in the past. But for those that are listening, Helen Newberry Joy, critical access, is it a traditional? What? Give us the history of it.
Yeah, so this hospital has been in the community about 60, 70 years. And we're a small critical access hospital in Luce County. So Luce County is on the eastern end of the Upper Peninsula, about 6,000, 6,500 people in the community. You would think we would be the largest employer, but we're not. Yeah. There's actually two larger employers in our community. So there's a little bit more infrastructure there. So that's nice.
Yeah, that's very good.
Yeah, we have, 25 inpatient beds and 4 physician office clinics that are in outlying communities. And then one thing that I just think is the jewel of Helen Newberry Joy is our assisted long-term care living center called Golden Leaves.
Golden Leaves. How many beds?
39 beds. That's 39 huge. Wonderful residents, elders that we get to care for and cherish. And I just love that part of it.
It's great that you have that opportunity up there, because I'm sure it's a huge need to have long-term skilled care.
It is. I think that when you look at community health needs assessments across the state of Michigan and in other areas, elder care, housing is a big need.
It is.
People just are not staying in their hometowns and taking care of grandma and grandpa that we did traditionally.
Right.
So we're honored to be able to take care of them, and we have great programming. They're our friends and our family too, and we really make it special for them with great events like a senior prom.
Well, that's awesome.
Cocktail hours. Yeah. It's fun.
Yeah, it's really the heart of what we do.
It is.
It's encouraging to see. So for, Helen Newberry Joy, you've been in your role for how long now?
Since last August.
Oh, has it been that long?
Yeah.
So it's almost a year?
Closing up on a year.
I did not know that. Wow, time flies.
It does. When you're having fun. And we are having fun.
And that is so great. I see a lot of LinkedIn posts with you at every event in the community, from chili cook-offs to auctions. It's encouraging to see. I'm not the only one going to those. And so
love
they're fun.
Community involvement.
Yeah, you can tell.
Yeah, and it's a big deal for me. I think the community needs to know that we are their health and wellness center. We're their neighbors. We're there to take care of them. And who doesn't love a good Friday night football game?
Absolutely. Chili cook-off
Yes,
afterwards.
I'm on the sidelines cheering for those kids. And
good. So, Helen, what projects, programs, anything that really just has been good for you in the last year that you're really proud of?
So, a couple of big things that have been happening up there at Helen Newberry Joy Hospital was previously we were a municipal hospital, and so like a county hospital, and there's not that many of those left in the state of Michigan.
I did not know that.
Yeah, so on October 1 of 2024, we were able to actually become a fully independent 501c3.
Nice.
So that just opens up.
Congratulations.
It was
funding
a lot
opportunities
of work.
and
a lot of work, and obviously with me coming in August, a lot of that pre-work was finished by the previous CEO and the board.
Well, it's been great to have you here. I know that we have a lot of things ahead of us the next few days as we talk about some of the significant obstacles that we're going to be faced with dealing with in our respective communities. But it's always great to have you on the podcast. Stay tuned for the next week's Summit Series update with another great guest. Until next time, remember the power of rule. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.